Obstetricians say the odds of the average woman giving birth to twins are about 1 in 90. But the odds of a heart transplant patient delivering a set of twins, well, that's unheard of, at least until now. NJN News health and medical correspondent Sarah Lee Kessler explains in this exclusive report.
Hey, excuse me.
Any parents would have their hands full with new twins, but for this Wayne couple, every whimper from Natalia and Melania is a symphony. Stefania and Rich Mayo, who've been married for 5 years, were desperate for children. But first, Stefania, who had a fatal heart condition, would need a heart transplant.
I had it for these two beautiful girls. That was my goal. And I told Dr. Barron, whatever I have to do to have kids, this is what I'm going to do.
So Stefania, who's now 29, underwent transplant surgery 18 months ago at Newark Beth Israel Medical Center.
This is Mommy's doctor that I gave a hard time.
Stefania became one of the few heart transplant patients in the world ever to risk pregnancy.
It's probably the only 40th case of a heart transplant patient having a child.
Dr. David Barron performed the transplant, then worked with Stefania's other doctors to help make his patient's baby dream a reality.
You have the risks that the pregnancy itself changes the immune system and you can have rejection. You have the risks that the medicines themselves may cause birth defects.
And this couple faced another hurdle. Stefania wasn't just pregnant, she was pregnant with twins, a first in the heart transplant world.
Almost passed out.
But it was no laughing matter. Twin pregnancies are always considered high risk, but in a heart transplant patient? Then there was another development. It turned out Stefania's twins were identical, sharing one placenta and also sharing a rare, life-threatening disorder called twin-twin fetal transfusion syndrome.
We had what is called double jeopardy. So one baby is small, losing blood and anemic, and the other baby is becoming bigger. So one baby is developing heart failure.
So Stefania underwent surgery at Children's Hospital of Philadelphia to divide the placenta. The babies arrived in late December in Newark, 6 weeks early, Melania weighing just over 4 pounds and Natalia weighing 2 pounds, 13 ounces.
You remember this girl? That's your sister.
Melania went home after 16 days in the Neonatal Intensive Care Unit. Natalia, who needed intestinal surgery so she could eat properly, was discharged yesterday. What's the prognosis?
Prognosis for both of them is excellent.
I want them to have everything in this world because they are my everything.
It's just been a miracle. The whole journey has been a miracle. For the past 5 years has been a journey of miracles. And we're just blessed to have them at the end of this whole journey.
Back home in Wayne, the twins are also blessed to have a grandmother who's a retired pediatrician. Sarah Lee Kessler, NJN News, Wayne.